Prof Lim, maybe you could share what are the challenges of diagnosis of aHUS in Malaysia itself?
So as you understand this condition, right? So we are talking about, of course, to make a diagnosis, it's actually more clinical. I mean, based on the presentation of the patients, then we have to run a series of laboratory tests. And also, more importantly, is to exclude some of the conditions that can present the same way, right? So by understanding this, then we know, I think there are many challenges, but I want to highlight 3 in the local setting. The first thing is, of course, as Prof Hyler mentioned, this is actually a rare condition. So nephrologists might not be seeing this day to day, so they may not be familiar, then sometimes can lead to late diagnosis. The second thing is, of course, our local capacity in terms of diagnostic. Because one of the important things to make a diagnosis of aHUS is to exclude the TTP that I mentioned just now. So one of these tests is called Adams DS13 testing. So for meantime, Adams TS13.
Okay.
Right. So this particular test for the meantime in Malaysia is only done by one lab under Ampang Hospital. Because it's not a common condition, so people tend to centralize the test. So, and this test, where the lab need to batch the test, so the turnaround time is 2 to 3 weeks. Yeah, so that is actually one of the challenges. And of course, we know that coming to treatment of the condition, and because this is actually not a common condition, so sometimes getting access to the essential treatment can be challenging as well. Because some of these medication may not be readily available in the hospital. So when clinician is facing with this condition, they often need to put on application to actually get the drugs, and that may take time. So these are actually the 3 main challenges we are facing locally for this particular condition.